How can I avoid the side effects of prednisone? Hi, I'm Dr. Megan, the prednisone pharmacist, and I was contacted and a girl asked, "Hello, Dr. Megan. I'm 17 years old. How to avoid the side effects of this medication? I'm having swelling in my face. I'm very upset. Help me." So, for Arushi and anyone else suffering prednisone side effects, I'm here to help you. I personally had to take prednisone, and it was one of the most miserable experiences of my life because I suffered all of these side effects. It was horrible. And so I went on a mission to figure out exactly what to do to counteract prednisone side effects. And I discovered that there's a ton of research, but nobody's really ever compiled it before. So, without further ado, here are 5 ways to counteract prednisone side effects so you can avoid the side effects of prednisone. So, first, the American College of Rheumatologists, the doctors who prescribe prednisone the most, and they created a guideline specifically to counteract what they perceive to be the worst side effect of prednisone. And that's osteoporosis, or bone loss that can lead to fractures, broken bones, broken hips, and loss of height. And so they want to prevent that permanent, irreversible side effect. And these are the tips that they offer for people taking prednisone. And these tips don't just help osteoporosis, they can help other side effects of prednisone as well. So the very first thing that they recommend is to quit smoking. Not only does smoking affect your bone integrity and your ability to have strong bones, but it can also affect your heart. And heart complications are one of the main ways that prednisone kills people as a side effect. So we don't want that to happen. And so quitting smoking is the first thing. Second, minimizing the use of alcohol or quitting drinking alcohol while taking prednisone. And that is because not only does alcohol affect your bone strength and bone mass, but alcohol can also affect several other things that prednisone is doing to you. So prednisone is in a class of drugs called glucocorticoid. Gluco meaning glucose, meaning blood sugar. So prednisone itself is affecting your body's ability to metabolize sugar and use it properly. Usually it ends up with high blood sugar that can lead to weight gain. So alcohol itself can affect your blood sugars. In fact, it often has a lot of sugars added to it. So the combination of the blood sugar spikes from the alcohol and the way prednisone is affecting your blood sugar is just really hard on your metabolism. So minimizing or stopping the use of alcohol altogether is a great way to avoid side effects from prednisone. Another way that alcohol affects your body is that it is affecting your adrenal system. Your adrenal system is your cortisol stress response system. And so prednisone is actually mimicking cortisol and replacing it in your body. Your body stops making cortisol when you start taking prednisone. So when you are replacing cortisol and then you're affecting cortisol with the alcohol, the combination is really hard on your ability to respond to stress. There was a guy who reached out to me and he said, "Please tell everyone my story. I went binge drinking one weekend and I went cold turkey off of prednisone the same weekend." And he paid for it for a long time because it was so hard on him. And he was a young guy. And so it's just too much for your body to handle. While you're taking prednisone, pretend as if you're on chemotherapy because, in fact, prednisone can be a part of chemotherapy regimens. Treat yourself with the grace and gentleness that you would if you were undergoing a cancer treatment, because it is a part of a cancer treatment for some people. So if it requires you to go off alcohol, go off smoking, then do it. It's worth it. Number 3, they recommend that you exercise, weight-bearing exercise. So things that are affecting your bones, things that cause impact on your bones, because your bones, like your muscles, when they have small impact, when there's small muscle tears, they grow back stronger. Same with the bones. When there's a little bit of impact from walking, running, dancing, or any other activity you like to play, tennis, pickleball, whatever it is, those little impacts help the bone build back stronger to help prevent further bone loss. And in fact, There are physical therapists out there who can help you find the exact right exercise for you, depending on your situation. So then the fourth thing they recommend is eating a diet that is rich in the nutrients that you need while on prednisone to minimize weight gain. They want you to have a healthy weight because either too high or too low of a weight can be very detrimental on your bones. In fact, the typical person who gets broken bones from osteoporosis is a lightweight Northern European descent woman who's postmenopausal. And so you don't want to be too underweight either. You want to have a good, healthy weight somewhere in the BMI of 20 to 25. That's the best strategy to go for. And so you need to eat foods that support a healthy weight, avoiding high sugar foods, because as I already mentioned, prednisone's affecting your sugar, and avoiding high salt foods because prednisone is affecting your ability to get rid of salt and sodium and messing with your kidneys' balance of water. So not only are you gaining fat around your face, but you're also getting water redistributed around your body. So you want to eat a healthy diet to minimize the bone loss. And the number 5 thing they recommend is to supplement the nutrients that prednisone is stealing. Prednisone has been shown to steal many nutrients, at least 9 and possibly up to 15 different nutrients prednisone steals. The 2 that the rheumatologist doctors recommend supplementing include calcium and vitamin D. And most people are aware that calcium helps support strong bones. Vitamin D is vital for getting the calcium where it needs to go in your body. But it's not just calcium and vitamin D that you need for strong bones. It's also magnesium. Magnesium is needed to keep the calcium in balance. They're kind of, when one's high, the other one's low. So you need to keep them in balance. And then vitamin K2 is necessary to tell the calcium to go to the bones and not to the arteries and have calcification of the arteries, hardening of the arteries leading to further heart disease. So you want to make sure you're getting all of those nutrients to help support your bones. Now, the girl who reached out asking this question, she was specifically asking about her face, her Moonface. Now, Moonface is one of the trickiest side effects to counteract, but the most important thing is to get on the lowest effective dose. So the higher the dose of prednisone, the rounder the face. The lower the dose, the back to normal the face. And so work with your doctor and pay attention to your disease to get on the lowest dose that you can possibly use. And make sure you don't go cold turkey, but keep it the lowest effective dose. And there are other nutrients that are affecting the blood sugar system. So one of the nutrients that prednisone is stealing is called chromium. Chromium is a metal mineral that is normally in very small supply in your body, and it usually stays pretty stable. But when you take prednisone, your body pees it out, and you suddenly have a low level of chromium in your body. Now, the problem here is your body uses chromium with insulin to make a matrix that helps keep your blood sugar stable. And when you don't have enough chromium, that leads to blood sugar issues. And I already mentioned prednisone itself is causing blood sugar issues. Is it because of the chromium loss? Potentially, and probably some other factors as well. But when you replenish the chromium, that can help keep your blood sugar stable, help keep your body weight stable, help keep the redistribution of body fat stable. So you're not getting as much moon face, truncal obesity, and buffalo hump. Those are the 3 places, the belly, the shoulder and hip, and the face, where prednisone redistributes fat. We don't want that. And so if you are replenishing chromium, that can really help to keep that at a minimum. And I already mentioned how prednisone can affect your muscles. Well, chromium picolinate, a special kind of chromium, can help keep the muscle mass stable. Instead of losing muscle weight, it helps you lose fat weight and maintain muscle mass. So it's ideally suited for people taking prednisone. There are other herbs that can help support a stable blood sugar as well, including berberine and cassia bark. And if you're thinking, wow, that's a lot of things I need to figure out how to supplement, and how much is that going to cost, and how many pills a day am I going to have to swallow? Well, if you went on Amazon right now to try to buy all of those, it would cost over $400 a month. But I figured out how to combine all the most important nutrients at the exact dose that you need while taking prednisone. And I invented something called Nutranize Zone. Nutranize Zone is a morning and a bedtime bottle where you take 2 in the morning with your morning dose of prednisone and 2 at bedtime to help you get restful sleep at night. And when you do that, it helps support you so that you can counteract as many side effects as possible because you're replenishing the nutrients that prednisone is stealing. You just go to Nutranize.com and you can get Nutranize today, or you can even find it on Amazon. And I invented it and I'm really proud of it. It's helped thousands of people counteract prednisone side effects and help them feel like themselves again. Just go to Nutranize.com and get your support that you need today. Signing off as Dr. Megan, your prednisone pharmacist.